What is sciatica? Sciatica, also referred to as lumbar radiculopathy, refers to a common condition affecting the lower back. Now, the sciatic nerve courses from the lower back into the buttocks and goes down to the legs. Now, anywhere in its distribution, the sciatic nerve can get compressed or irritated or pinched, leading to these range of symptoms. Now, sciatica can lead to a great amount of disability and a real poor quality of life. One is increased age, which leads to age-related wear and tear of the disc vertebra complexes. Then there is obesity that can be a predisposing factor, sedentary lifestyle, smoking. Taller individuals are more predisposed to developing sciatica as compared to their shorter counterparts. Then other occupational risk factors include people working with dealing with heavy lifting, bending and twisting activities of the lumbar spine. Coming to the organic causes which bring about sciatica, the first and the most commonly seen is disc herniation or disc migration. As the jelly-like nucleus pulposus of the disc, it emerges out of its normal constraints and advances, it can give rise to symptoms of sciatica due to irritation of the nerve roots. Second is spinal stenosis, where the central canal of hosting the spinal cord, it narrows down due to degenerative changes. Many a times an osteophyte from a degenerated facet joint can also pinch on a nerve, leading to sciatica. Then trauma due to road traffic accident or sports injury can also lead to rupture of the protective covering of the disc, leading to disc herniations and sciatica. Piriformis syndrome. Now, piriformis muscle is a muscle located in the buttock area, and sometimes due to the spasm or irritation of the piriformis muscle, the sciatic nerve which courses through it can also get irritated, leading to symptoms of sciatica. The classic one is a sharp shooting pain which the patient experiences starting from the lower back going all the way down to the leg. Now, the patient describes this as a burning or a shock-like sensation going from the back all the way down to the leg. The other thing that we commonly see is associated tingling and numbness. Now, it might be just pin pricks, the tingling sensations, or it may range to complete numbness also of the affected area of the nerve. The other thing that is seen in advanced cases is muscle weakness, as the nerves they supply to a group of muscles in the lower limbs. If suppose a nerve is affected supplying a particular group of muscles, it can be seen that these muscles show motor weakness. Aggravation of symptoms can be seen in anything which increases the intradiscal pressure or the intrathoracic pressure, such as coughing, sneezing, and also activities like prolonged sitting and standing can also lead to worsening of symptoms. First of all, MRI is the gold standard investigation of choice because it tells us exactly the level of the disc affected and the state of the nerve roots also, which are lying close to the affected disc. The treatment, usually a conservative approach is initiated for the management of sciatica, which includes rest, activity modification, non-steroidal anti-inflammatory drugs, cold and heat packs to relieve the symptoms. If a patient does not respond to this, then they are subjected to physical therapy, which involves exercises and stretches to strengthen the lumbar muscles. If these non-interventional methods fail, the option becomes a transforaminal or an interlaminar epidural steroid injection, which is usually done under fluoroscopy. Now, this epidural injection comprises of a mixture of local anesthetic and steroid and is given under image guidance to the affected area to help relieve the inflammation and pain. Now, at Alleviate, in cases of sciatica where there is also associated degenerative disc disease, we go ahead and treat these patients with PRP and prolotherapy of the lumbar region in order to strengthen the lumbar segment to prevent this from happening again. Now, cases which do not resort to any of the conservative means will have to be subjected to surgical means. Now, the surgeries which are generally undertaken in these conditions are discectomies, and sometimes fusion surgeries are also done to relieve the symptoms. A message to our viewers is that don't neglect sciatica. It might seem like a trivial problem in the beginning, but neglected, it can lead to profound disability. If you are suffering from sciatica or any of your loved ones are suffering from this condition, please reach out to Alleviate at any of our centers in Bangalore.